Good morning. My name is Jason, and I'm currently a PhD candidate at the Department of Surgery. Today, I'll be speaking to the topic of value in surgery. So, to begin with, we know that osteoarthritis is a very common, very disabling condition that affects millions of Australians. The impact on community health is significant, but it's also important to recognize that it's a very progressive and degenerative condition. And the impact on patients really ranges across a wide spectrum of severity, from completely asymptomatic to advanced stages with significant pain and functional impairment. And so, whilst a lot of effort is made to optimize the non-operative management of this condition, unfortunately, these measures don't change the natural course or the natural history of the condition, which tends to progress over time. Now, the limitations of non-operative treatment really become evident in advanced stages of osteoarthritis, where there's significant pain, functional impairment, deformity, and loss of quality of life and independence, which can have considerable effects for both the physical and the mental health of patients. And it's really here where the role of surgery becomes particularly important, because it's at present the only definitive solution to a problem that can be tremendously debilitating when there are no other treatment alternatives available. And on the whole, surgery is very effective at achieving its goals when used appropriately. Because of this, it's not surprising that total joint replacement, both knee replacement and hip replacement, have been recognized as one of the greatest operations available in the 21st century. And in fact, knee replacements and hip replacements rank alongside cataract surgery as one of the three procedures that offers the most quality of life to patients. Only cataract surgery has been rated higher than both hip and knee replacement surgery. And again, largely owing to the success of joint replacement, there are now increasing numbers of procedures being performed, with each individual operation attracting a cost to it. Now, there are many different factors that feed into the cost of care, a large part of which is the cost of the prosthesis. But a large proportion of it is also related to the other components of the healthcare system, which are required to really successfully navigate a patient through the joint replacement procedure. Because surgery isn't really a one-size-fits-all approach and it's tailored to the individual patient, it's important to recognize that there will be some expected variation in both the outcomes and the costs due to this individualized nature of treatment. But there are also what we often term unwarranted variations, where the differences in costs don't necessarily represent or translate to improvements in the quality of care. Now, these inefficiencies become particularly meaningful when we consider projections of current and future total joint replacement utilization. There was a study published fairly recently by Ackerman and others that made projections through to 2030 based on joint replacement volumes in 2013 under a range of different scenarios that accounted for both a constant and an increasing rate of utilization, with the rate of utilization being measured as the number of joint replacement procedures per 100,000 members of population. Now, in these scenarios, the projected or anticipated costs in 2030 to the healthcare system of both hip and knee replacements together is expected to be greater than $5 billion each year, with approximately 2/3 of this being incurred in the private sector. Now, the private sector currently performs approximately two out of every three joint replacement procedures in Australia. Naturally, this leads us to the question, well, what is value in surgery and why does it matter? Fundamentally, I think the key point here is that in reality, we know that we operate in a healthcare environment where our interventions are resource intensive. And we're also highly constrained by the finite healthcare budgets, with limited funding available to fund a wide range of competing interventions, of which orthopedic surgery is but one part. And so, to ensure that surgical services on the whole are adequately funded, I think the value of the intervention needs to be justified to support this ongoing investment in service provision. What this requires is an adherence to the principles of value that is being geared towards optimizing outcomes for the lowest cost, and not just focusing on cost minimization alone. I think the consequences of not considering this as a factor is really the potential downstream effects. And we've observed this in other jurisdictions like the US and the UK, where there have been trials of different payment models and rationing of access to total joint replacement using certain criteria in an attempt to limit the cost impact. But in summary, I think if value and cost effectiveness can be demonstrated, then what it is it's essentially a defense against rationing when competing against funding or competing against other interventions from funding from a limited pool of resources. And extending on this subject, should value matter to surgeons? And I think the simple answer is yes. Firstly, it's central to the code of conduct, where surgeons are expected to promote sustainability in healthcare through the judicious use of health resources, and also to allocate health resources in a transparent and equitable manner. As clinicians, we operate in both public and private settings with resources which are limited, and so there's a duty to ensure that value is delivered for both our current and our future patients. The different value perspectives can be assessed in terms of maximizing the benefits and the outcomes, in terms of mitigating the risk of complications, and also in terms of giving due consideration to more cost-efficient alternatives where the benefits are largely comparable. This doesn't necessarily mean sort of cheaper or poorer quality care, but what it does mean is equivalent or superior quality of care being provided at same or lower cost when those options are available. And this really has the potential to improve the overall value and longer-term sustainability of our surgical services, which are really an integral part of the management pathway for patients with arthritis. Now, there are a number of perspectives which we can really consider, and these all reflect the varying perspectives of the stakeholders involved. What I've listed here isn't an exhaustive list, but it does aim to highlight a few of the major factors and considerations at play when we're weighing up alternative interventions. Specifically, it's whether the proposed intervention is able to affect or influence any one of those factors to improve outcomes, again, to reduce complications or costs, and therefore improve the overall value of care that is being delivered. It's also important to recognize that the value of an intervention can be seen differently between the various stakeholders involved, despite sharing an overarching goal. And these factors can be weighted differently. For example, whilst the ability of a certain technology can afford a surgeon improved technical accuracy and precision and potentially ease of use, may not be a concern to the patient directly, it does have practical relevance to the surgeon who's actually performing the operation. And therefore, this benefit can be considered to add value to the process of care. In determining whether something is of high or low value, there really needs to be sort of a standardized metric which can be used to aid comparative evaluations. And one of these metrics that many probably would have already heard of is cost effectiveness, which standardizes the value measure into a unit that's calculated as the cost, usually in dollar units, per quality adjusted life year. And broadly speaking, one of the objectives of shifting surgical care from lower value towards high value is to identify and utilize more cost-effective interventions in lieu of lower value interventions. And again, there is often a high degree of variability, however, in the range of factors which contribute or influence cost effectiveness. And these can exist along the entire operative pathway. All these factors have the potential to influence or affect the outcomes of surgery, to affect patient recovery, to affect complications, and also resource utilization, including the direct financial costs. The surgical pathway can be quite complex with a lot of different factors to consider. And shifting lower value care towards higher value care requires us to firstly identify all the elements along each step which can influence this, and so we can appropriately evaluate the impact on the cost effectiveness of surgery. In orthopedics in particular, we often see the introduction and adoption of new and novel technologies, introduced in practice. And innovation is really critical to progression. The whole development of the modern joint replacement procedure is truly the result of significant historical advances and innovation from previous generations of innovators, clinicians, and researchers. But it becomes a bit of a problem when uncurbed enthusiasm and adoption of technologies, before they're properly evaluated against existing standards, can result in the introduction of lower value into practice. And so I don't think this should be done indiscriminately. And it's really in this context that there have been numerous studies that have examined the cost effectiveness of total knee replacement. And the current evidence suggests that across the board, total knee replacement and total hip replacement also are largely cost-effective interventions when performed appropriately. But the value proposition and the cost effectiveness of total knee replacement and total hip replacement are again influenced by factors such as the patient population, which is receiving the operation, choices related to the use of prostheses and technologies, and also the institutional settings in which the surgery is undertaken. Now, technology in particular, in orthopedics, play an increasing role in what we do, but they come at an additional cost. And importantly, these additional costs can modify or influence the cost effectiveness of the total joint replacement procedure. And so it really needs to be justified by realized benefits or measured benefits to ensure that value of care is not shifted towards the lower end of the spectrum. I think in particular, this has particular relevance to orthopedic units and health service organizations that are the other ones who are weighing up the potential adoption of implants and technologies into the surgical inventory. Orthopedic surgery is a very high technology discipline. The work we do utilizes a wide range of highly engineered implants and technologies. Access to and utilization of these technologies again incurs costs, which can add to the cost of surgical services provision. And so the indication for these technologies to be used should therefore be very clear and demonstrated. That is, it should be able to be demonstrated that they do provide the benefits that we expect them to provide. Now, unfortunately, sometimes the enthusiasm for adoption precedes adequate systematic evaluation. And what this ends up resulting in is high cost of care without realized benefits. And so I think research that's directed and aimed at evaluating the value proposition of various surgical interventions plays an increasingly important role in both informing and guiding the decisions that we make related to the adoption, the utilization, and the sustainability of surgery moving forward. Ultimately, surgery has tremendous value in improving the lives of patients with advanced disease, but it does come at a high financial cost to the healthcare system. We're all operating in a highly constrained environment that's limited by a finite healthcare budget. Additional costs can be acceptable, but they need to be justified by the data and the evidence of their value proposition. And data-driven research is required to both inform and guide practice and policy decisions to ensure that the interventions that we're undertaking and performing for patients are clinically as effective as we think they are, and that they are as cost-effective and sustainable as they can be for the healthcare system moving forward.